Good afternoon all, and welcome to one of our live sessions that we do weekly. Today we are back with yet another interesting topic which you should all be well aware of: RTPCR and COVID-19. What are the do's and don'ts, the early signs that you need to recognize? Joining us today on our live session, we have Dr. Tricha Kulhalli, Senior Consultant, Pathologist at Specialist Hospital, Bangalore. Welcome, Dr. Tricha.
Thank you.
Since we are talking about RT-PCR and COVID-19, what does COVID-19 infection mean to the general public?
A very good afternoon to everyone, and thank you for having me over on this live session. COVID-19 is the novel virus. The virus is a coronavirus, a virus that is called coronavirus because it wears a crown which is made up of spikes, and it causes infection in the lungs. But moreover, all of these 2 years of the pandemic that we have seen, it has caused a lot of panic and a lot of anxiety because this is the first time everyone in this lifetime is facing a pandemic. So the general population was definitely went through the Kubler's 4 stages of denial and anxiety and anger and bargain, and now we have finally come to the stage of acceptance, and we have accepted it so well that we've probably started ignoring it now, but it's still around, it's still there. I think the most affected were nations which had a lot of financial losses, a lot of precious lives were lost, a lot of people fell sick, and I personally feel that the old clan and the youngest clan of kids went through a lot because they had to stay home to be safe, and they had a lot of online schooling and all that. So COVID-19 for the general public has created havoc, and that is why we are doing all that we can to get over it.
Speaking about the virus, what does this virus actually really do?
The COVID virus, or the novel SARS-CoV-2 virus, has a special attraction towards the cells in the lungs. So it basically gets to you through the mucosal surfaces and the oral surfaces of someone who is infected through droplet infection. And once that happens, this virus, not like any other common cold virus, but it will go into your lungs. Once it enters the lungs, it starts damaging the lungs and the cells in the lungs. And so what happens is that because the lungs usually carry the oxygen to the rest of your body, and the lungs are damaged, we end up getting less oxygen to other organs of the body. Apart from that, there is also something called as a cytokine storm. So the immune system sets ablaze, and a lot of chemicals are released into the body, which creates a havoc. There is also these some patients called as long haulers who end up having all symptoms of COVID after 2 or 3 weeks, and they go on for months. So the virus is one that causes a lot of problems. But the good news, as we all know, is that it doesn't affect everybody so severely. It affects only the people with comorbidities and who have pre-existing conditions like diabetes, hypertension, old age. People who are on steroids or on chemotherapy drugs, they have basically a low immunity to begin with, and then on top of that, all these problems. So this is what the COVID virus does to your body.
What are the reasons to get tested, and when should these tests be done?
Well, there are many reasons to get tested. The most significant ones are if you have the symptoms. The symptoms of COVID vary widely between simple symptoms like cough, cold, fever, to sometimes people have loss of taste or smell. People end up having pain, abdomen, rashes, all of these. So all these people definitely need to get tested. There are also things like, I just have a mild diarrhea, or I just have a small headache, I'm going to be fine. So the reason you need to get tested again is because you are living with people who could get a more severe infection than you have. So these are the people who need to get tested. The other reasons are if you have come in contact with someone who had the virus, and you found out, like, oh, I went had lunch or had dinner with them, and then now they've tested positive. So it's again important you get tested, because if you don't, then you might end up giving it to someone else. And so we need to, all these people need to get tested. Now the other lot is people who want to travel to see their near and dear ones, to see the people who need help. So taking domestic or international flights, people who need surgeries, especially elective surgeries or certain procedures, they all need to get tested. So apart from all these, the tests are specially done so that you trace them, and the test has to be done in such a way that you are able to go back and make these people stay in isolation and take precautionary measures.
Thank you, Doctor, for explaining why they need to be done and when these tests should be done. So coming to the testing, what is RT-PCR test and what is the procedure?
Very fancy name, RT-PCR. So many words have been added to our vocabulary in this pandemic. Quarantine and isolation and RT-PCR. Never heard of tests, but RT-PCR has been going on for many years now. And luckily for us, we had this technology readily available when we had to test our patients suffering from this virus. So RT-PCR stands for reverse transcriptase polymerase chain reaction. It is when RNA virus like corona or COVID-19 is amplified in a technology wherein signals are generated. Now the idea is, the more the virus in you, the lesser time it takes for it to be picked up, which means the CT value or the cycling threshold value is low. And ideally for RT-PCR, a threshold value of 35, less than 35 actually, is considered as positive. So it has taken less than 35 cycles to pick up the virus in your sample. So a low CT value technically means that you have a lot of virus in you. But that should not change the way the virus or the disease is treated in you. Okay. What is the procedure? Now we have a wonderful tracking system called the ICMR has come up with the RT-PCR app. So what happens here is, when you come in and ask for a RT-PCR test, something called a SRF ID is created. It is a unique 13-digit ID which is generated with the help of the mobile number and OTP and all that. So in case you test positive, we can easily call you and help you out. And once that is created, a sample is collected, ideally from your nose and your mouth. A swab is put very deep into your nose and your mouth. It is irritating, but that's the best way of collecting the sample, because like I said, that's where the virus is sitting. So once that is done, what we do is it is put in a media called as viral transport media. It protects the virus from getting destroyed until it is processed. After that, long procedures for about 3 to 4 hours minimum is done on these samples, and we try to pick up the RNA of this virus through this test. So once we get the report as positive or negative, we inform the authorities, the BBMP, and then they come and help you out and guide you on what needs to be done, and tracking is done. So it's a notifiable disease, and that's how RT-PCR works.
What does it mean when you have symptoms but you test negative?
So RT-PCR and the COVID virus, actually, it works like mathematics, okay? So RT-PCR will be positive only when you're shedding the virus. When do you start shedding the virus is 44% of them actually start shedding the virus 2 days before they get the symptoms. So if you are shedding the virus, or the virus is sitting inside your nose or mouth, you're going to test positive. There have been instances when a couple, the wife has symptoms, the husband is asymptomatic, but the wife RT-PCR is negative and the husband turns out to be positive. It simply means that the lady has stopped shedding the virus, and that's why it's negative, but doesn't mean that she doesn't have the COVID. So what I generally recommend is once you know that you've come in contact with someone who's tested positive, quarantine yourself, isolate yourself, wait for 48 hours, come back into the lab, get yourself tested. The chances of you turning out to be positive with an RT-PCR are more. So that is one of the major reasons why you test negative. So you will only get a positive test between 2 to 7 days, which is the incubation period. And before that you will be negative, and after that also you will be negative in spite of having the symptoms, in spite of in fact having a full-blown COVID infection. The other tests like HRCT of the chest, which actually tells you whether you have the lung involvement or not, generally comes up after that 7 days period of not having RT-PCR positive. So you remember the time when we had like 22,000 cases in Bangalore in a day? There was a complete chaos when my RT-PCR is negative, but I have the chest X-ray. But that's how it works. You don't have the viral shedding, your RT-PCR is going to be negative.
Thank you, doctor. What is the difference between RT-PCR, rapid antigen test, and antibody test?
Excellent question. We have a lot of doubts that come up with this types of tests. There are various types, ways you can test for the COVID virus. The first, of course, I told you is the RT-PCR, which picks up the RNA from your mucosa of the nose and oral cavity. The rapid antigen test is earlier it was not, but now it is readily available even in pharmacies. So if you feel you have the virus, you can just go get yourself tested. But what happens is the sensitivity of our rapid antigen test is very less. It's only about 60 to 65%. So you might have the virus, but your antigen might come negative. So, but you get to know it very quickly. Within about 5 minutes, if a line shows up, you know whether you're positive or not. And it comes positive only when the viral load is very high. So if you have a very little viral load, but you're still shedding the virus, but the load is very less, your antigen is not going to come positive. Now, antibody test is something that tells us whether you have developed protection to the virus or not. And how it works is, there are two ways to get the antibody in your blood. One is if you got yourself vaccinated. So whichever vaccine you take, if it has worked, you are going to have an antibody or a protection against the virus. The other test, the other way is if you've been naturally infected. We know about these asymptomatic carriers who have got the virus, they have been affected, but they have never developed any symptoms. So they also sometimes end up getting the protective antibody. So I've seen so many people, they just randomly come and get their antibody tests, and then they figure out whether that they have a high antibody level and say, oh, I never got the virus, but I've got high antibody levels. So that's what asymptomatic carriers do. So there are two different tests, by the way. One to check if your vaccine has worked, and the other to check if you just have overall antibodies to the virus. There are other tests also, like CBNAT and True PCR and Gene Expert. These are all they were used to diagnose tuberculosis, but because of so many cases coming up, the technology has been roped into detecting COVID-19 in the pandemic. So there are various tests, but I generally recommend doing RT-PCR at the right time is going to give you the most definite diagnosis.
What are the tests available for further management and prevention of the infection spread?
The pandemic has made initially none of us knew how to monitor what havoc it is causing. We knew it is doing this and that, but monitoring of how to stop the further spread in your patient, or how to monitor it, it only evolved with time. Evolved very quickly, but evolved with time. The basic tests that are done when you get the virus are CBC, that is a complete blood count. Your doctor would want to see the amount of different types of cells in your blood. And then they will do a test called C-reactive protein. This test will tell you how much of inflammation or how much of that cytokine storm I told you has set in. The doctors also prescribe certain other investigations to see how your liver is doing, how your kidney is doing. The major problem that the COVID virus causes is forming of blood clots. And many tests are there to detect, blood tests and ultrasound tests to detect if you're forming any clots. And if you are, they put you on certain medications to stop them. So there are many tests that have evolved. These tests should be prescribed by your doctor at the right time. And all doctors who have looked after COVID patients, they know exactly how and when to order them. So if you do have the virus, unfortunately, please get in touch with your doctor, and they will monitor your disease and how it's progressing and what all needs to be done in that regard.
Thank you, Doctor. One of the most important factors or components that we have to follow or maintain during this pandemic is wearing a mask. First of all, why do we need to use a mask, and does it really help? If so, what kind, and how are we supposed to dispose of the used masks for people who are not positive?
Whether you're positive or not, there is no doubt that masks have a protective value. Masks, especially of 3 layers, either of a cloth or plastic or the disposable masks, the amount of lives that they have saved, the amount of protection they have given, the exponential levels this pandemic could have been in if masks weren't used. I'm not saying everybody's still using them, and I am not wearing one right now just because we are doing a video, but otherwise I will be wearing a mask later. The idea is that a protective layer around the nose and mouth that actually sheds the virus is going to control the spread of this virus. Now, whether you have the COVID virus or not, if you are talking to someone and there is a protective layer in front of your nose and mouth, your mask protects the other person and the other person's mask protects you. So I have randomly gone and told many people, put your mask up. I don't see, even in a grocery store, I don't see someone even put a mask up, and I think everybody should do that, because you cannot underestimate how much protection a mask gives you. Having said that, the scale at which this pandemic has gone has actually, there is a downside of this, and the downside is that irrespective of how you use your mask or which mask you use, finally they end up in the landfills or in the burials, and once it ends up there, it always goes ahead and enters into our biosphere, where it harms the birds and the animals, and the birds get stuck into these masks and all. So I always recommend that you use a cloth mask, a disposable cloth mask, which can be easily washed, dried and reused. But if you do decide to use the single-use plastic masks, you must be committed to dispose them correctly. And how do you do that? If you do not have the virus, then you take the masks out from the back of your head or your ears, cut the elastic straps only, not the mask, dispose the elastic straps separately and the mask in a closed bin. But if you do have the virus, or anybody in your family has the virus, then you must put these masks in a breathable paper bag, keep it outside for about 72 hours, and then reseal this bag before you can dispose it in the closed bin. So this has to be done. The elastic straps actually get into the wildlife and the fishes and trouble them. So that is a very a good method, a good practice to follow. But again, like I said, the best thing to use is a 3-layered, washable, recyclable mask.
Thank you, Doctor. That would have been very valuable information shared with our viewers on disposing your mask right now. Coming back to the virus, if someone you live with is diagnosed with the virus and who doesn't need hospitalization, what measures should be taken to ensure the safety of others who live at home?
I think, Madam, till now, at least one of our family members at some point has gone through this panic situation. Oh, they tested positive. Oh, I went with them and all that. So the first thing to do is to know that what needs to be done, everybody knows it. Okay, so the ignorance is not there, and everybody can help you out, especially the hospitals and the doctors and the government, because they have seen way too many of these. But when such a thing happens to your near and dear ones, the first thing you must do is isolation. Isolate this person who has symptoms. In fact, isolation should begin from the time you've given your sample. And I gave my sample today, I tested positive. In that 2 days time, you have met so many people, right? So we need to isolate as soon as you have any symptoms and you have given your sample for testing. Having said that, all people with comorbidities in the family, what are those? Those are people over 65, not vaccinated, or people who have some comorbidities like asthma or lung issues or renal issues, people on dialysis. If there are any such people, diabetics, at home, you must try and keep them in another place, or the person with the virus in another place. Another place means a well-ventilated room, with basic amenities, and one person in the family will have to take care of this person, right? Because we take care of our own family, and that person should wear all the protective personal equipment, for example, gloves and masks and goggles, and only the food or vessels that we use to give them the food can be washed separately. And this isolation, this quarantine measures are very important. Having said that, all the waste that is generated with this patient at home must be segregated. You must segregate them into wet waste, dry waste, yes, but at the same time, all the waste should be packed in non-chlorinated yellow colored plastic bags. The BBMP, the government officials who pick up, government employees who pick up this waste, they know that yellow color means biohazardous. They are trained in that, and they know that it has to be taken away separately with caution. Having said that, if you don't have these yellow plastic bags, which are easily available online actually, but if you don't find them, then whatever waste is there, separate it, label it as COVID-19, and then give it out. So the people who are picking up this waste and the people who are helping clean our environment are safe. So that's how you look after them. Of course, monitoring oxygen levels and getting in touch with your doctor. You might need a repeat RTPCR as well. All these things are a part of care, and we have been doing phenomenally well. I think all our families, we've taken care of so many people. Everybody, like I said, we've come to that acceptance level. So these are all the simple things you can take care of.
Thank you, Doctor. That was very informative for most of our viewers, I think, of how to take care of their loved ones at home who are tested positive. What would be your final takeaway message for today?
The entire pandemic has taught us so many things. There cannot be 1 or 2 minutes of a takeaway message. But it is what has taught not just me, but I feel my colleagues, the people who worked like a machine with me during the pandemic. We had kept all our families, emotions, everything aside, and literally worked like machines. And one thing that I have personally learned from this pandemic is the strength that comes to you from somewhere. And everybody needs to hold up to that strength. We will get through this. We've gone through so many things in our life, and the pandemic is definitely going to get easier to live with. Things are going to be better. People are going to get vaccinated, and everybody is going to get back to normal very soon. So please follow the precautions, wear the masks, do the social distancing, allow the pandemic to end faster, vaccinate everybody, and I think we're all going to be just fine.
Thank you, Doctor. Yes, that is one reassuring line we have to remind ourselves every day. Yes, we will get through this eventually and in a positive way. Thank you, viewers, for joining us today, and hope to see you next week with another interesting topic. Till then, take care and stay safe.